Tobacco use is one of the leading causes of preventable death worldwide. Every year, millions of people lose their lives due to diseases directly linked to smoking and tobacco use. Despite the well-known dangers, tobacco products remain legal and widely available across the globe. This presents a striking paradox. Why in the world, where health awareness is growing, do we continue to allow something so deadly to remain accessible to public? Well, today I will argue that tobacco products should be banned from our country. The harmful effects of tobacco are undeniable, and the potential benefits of tobacco-free nation far outweigh the costs of such a decision. As we dive into this issue, first let's examine the massive health risks associated with tobacco consumption. From smokers themselves to those around them, tobacco affects everyone, often in devastating ways. When we talk about tobacco, we cannot ignore the vast health dangers that it presents. Increased risk of lung cancer. The connection between tobacco use and lung cancer is well documented. Smokers are far more likely to develop lung cancer than non-smokers. In fact, smoking is the leading cause of lung cancer, and the more someone smokes, the higher the risk. This disease alone takes hundreds of thousands of lives each year. Smoking also contributes to heart disease. Tobacco contains harmful chemicals that damage blood vessels, increase blood pressure, and raise cholesterol levels. These effects significantly increase the chances of developing heart disease, stroke, and other cardiovascular issues. Smokers often suffer from chronic obstructive pulmonary disease, COPD, and the chronic bronchitis. These conditions severely limit a person's quality of life and can lead to a slow, painful death. It's not just smokers who suffer the consequences of tobacco use. Increased risk of heart disease and cancer in non-smokers. Secondhand smokers contain over 7,000 chemicals, many of which are harmful and toxic. Non-smokers who are regularly exposed to secondhand smoke are at increased risk of developing heart disease and lung cancer. Impact on vulnerable groups such as children and pregnant women. For those children, exposure to secondhand smoke can lead to respiratory infections, asthma, and developmental issues. Pregnant women who are exposed to tobacco smoke risk complications such as premature birth, low birth weight, and even stillbirth. These effects are devastating, and they highlight how far-reaching the impact of tobacco is on society. Having examined several severe health risks posed by tobacco, let's now shift our focus to financial and social costs associated with tobacco use. These are often less visible, but just as destructive. Tobacco use is not just a public health issue, it also places a tremendous burden on economies and society. Healthcare systems are overburdened by the need to treat smoking-related diseases such as cancer, heart disease, and respiratory illness. The cost of these treatments is staggering, and much of this burden falls on public healthcare systems, increasing the financial strain on countries. In countries with universal healthcare systems, the cost of treating tobacco-related diseases often come directly from taxpayer dollars. This diverts resources away from other important health problems, such as preventing other diseases or improving healthcare infrastructure. Even when smokers are at work, they often suffer from reduced productivity due to health issues related to tobacco use. Chronic coughing, shortness of breath, and fatigue are just some of the issues smokers face, making it harder for them to perform at their best. Smoking can take a heavy toll on families, especially when a loved one becomes seriously ill. Families often bear the emotional and financial costs of taking care of a smoker with a debilitating disease, creating additional stress within communities. The normalization of smoking among youth. Tobacco advertising in social environments where smoking is acceptable can encourage young people to take up the habit. As they see older generations smoking, they may view it as a normal or even desirable behavior. The normalization of smoking among youth is one of the most insidious ways that tobacco perpetrates itself in society. Now that we've discussed the immense financial and social costs of tobacco use, let's turn our attention to the potential benefits of banning tobacco products altogether. Reduced smoking-related diseases. If tobacco were banned, we would see a significant reduction in disease like lung cancer, heart disease, and respiratory conditions. With fewer people smoking, the overall health of the population would improve dramatically. Studies consistently show that non-smokers live longer, healthier lives than smokers. By eliminating tobacco use, we would increase the average life expectancy, leading to a healthier, more vibrant society. Decreased healthcare costs. Without the burden of treating smoking-related disease, public and private healthcare systems would save billions of dollars each year. These funds could be redirected to the healthcare priorities, improving the overall system and quality of care for everyone. A healthier population means more productive workforce. Fewer people would be absent due to illness, and more people would be available to work at their full potential. This could have a significant and positive impact on the economy. With the removal of tobacco products from society, there would be fewer opportunities for young people to be exposed or tempted by smoking. Over time, this would lead to a dramatic reduction in the number of smokers. Without the harmful effects of tobacco, people would be more active and less likely to suffer from chronic illness. This could improve overall well-being, leading to a more vibrant society in both physical and mental health. In conclusion, we have explored the devastating health risks, financial costs, and society burdens of tobacco use, as well as the potential benefits of a tobacco-free nation. Tobacco is a deadly product that contributes to millions of deaths each year. Its toll on public health, economies, and families is profound and far-reaching. By banning tobacco products, we could significantly reduce smoke-related diseases, decrease the financial strain on healthcare systems, and create a healthier, more prosperous society for future generations. The benefits of banning tobacco products far outweigh the drawbacks. In a world where we have the power to make healthier choices, it's time to ask ourselves, wouldn't we be better off without this deadly product? A tobacco-free nation could lead to a brighter, healthier future for everyone. The time is to act now.